San Diego, and I'm a rheumatologist, but for over 10 years I've been dealing with autoimmune and rheumatic diseases which are associated with gluten and gluten intolerance. And so today we'll continue. Today is our talk number 2. So yesterday it was kind of general introduction in non-celiac gluten intolerance and what kind of problems people do face with this condition. Today the talk is kind of organic continuation, and the topic which I selected is the topic which is very pertinent to my practice and pertinent to all of you. Is so you do have gluten intolerance and you're completely gluten-free, but you still don't feel well. So the question is why and how it can be fixed. So these are two websites where the slides will be available. So again, today we'll be talking about non-celiac gluten intolerance. So by definition, what does it mean? It means that if we do the biopsy of your small intestine, the intestinal biopsy will be absolutely normal. So right here, so it's absolutely normal. And if we do actual light microscopy, so the intestinal lining of your gut will be absolutely normal. But at the same time, you're still gluten intolerant. What does it mean? That if you consume gluten, you react. So by definition, it's a non-celiac gluten intolerance, because celiac disease is based purely on the biopsy. You cannot make the diagnosis without the biopsy. And the second thing, it's a fixable condition. You just don't need to panic. You need to know what kind of problems exist and how to fix them. And I want to show a cartoon which I like. So I don't know if you can see it. So this is the future supermarket, healthy food, right? So all right, let's get started with the real thing. So if you're completely gluten-free and you still don't feel well, so these are typical situations which we see in our practice, and I try to categorize them and kind of create groups, and we'll talk about each group in particular. So first of all, it's a malabsorption and a nutrient deficiency. So we see it all the time. We talked about that yesterday briefly, and I'll emphasize the topic today. So the second topic is intolerance to foods cross-reactive with gluten. So gluten is a protein. It has very defined chemical structure, and unfortunately there are some other products which have similar fragments, and they're completely from different walls. Some of them are meat, some of them are dairy products, and so, but it's kind of unfortunate situation where chemistry plays a negative role in our body. Then we talk about Proliant intolerance. We talked briefly about that topic yesterday. Then we'll talk about yeast in the gut, or so-called intestinal candidiasis, and then a couple other things. Leaky gut syndrome, which quite a few people know in this room, what it's about, endocrine problems, and finally, it's a relatively new topic which we started exploring just recently. It's so-called diamine oxidase deficiency and food allergies. So the first topic is malabsorption and nutrient deficiencies. Again, we talked about that yesterday, and I just want to remind you that these are the common problems which we see in our practice, and these are the problems which can be picked up through the blood test. B12 deficiency, which is a part of pernicious anemia, is quite common. So typically a patient presents with fatigue, and the blood work is diagnostic, because when you're B12 deficient, your red cells get much larger. So by doing routine CBC or cell blood count, you can pick up, or at least become suspicious that something is going on with your B12. And B12 deficiency typically gives you enormous fatigue and some brain fog. Biotin deficiency is extremely common because biotin is produced by normal gut microorganisms, and when we have gluten intolerance, that normal gut microflora is damaged, and so the production of biotin drops. And typical manifestation of biotin deficiency is hair loss and brittle nails. So again, it's easily fixable with extra biotin consumption. Zinc deficiency is also extremely common, and zinc deficiency can cause dry skin. It can cause cracking lips, and also it can cause quite a few other metabolic problems. Zinc and copper deficiency very common together because in our gut there is one molecule which transports both zinc and copper, and again these deficiencies go together quite often. Iron deficiency is extremely common, and it's the most common cause of iron deficient anemia when your red cell count goes down. And again, typical manifestations of iron deficiency include fatigue and weakness, because we utilize iron as oxygen transporter, and also iron is a part of our kind of muscles. So because myosin, the main enzyme, the main protein in the muscles, contain iron. So muscle weakness and fatigue are two common manifestations of iron deficiency. Vitamin D deficiency, which can cause fragile bones and premature osteoporosis. Magnesium deficiency, which can cause muscle cramps, especially at nighttime, which is very, very common in patients with gluten intolerance, as well as elevated homocysteine. So not too many people pay attention to homocysteine, but it's a key metabolite. It's almost like a human waste. And basically, homocysteine is a very well recognizable risk factors in the development of heart attacks and strokes. And so routinely we recommend to monitor homocysteine level in patients with gluten intolerance because it's a very common problem. So, and then there is a problem and there should be a solution. So why we develop deficiencies? So not only because we're gluten intolerant, because gluten can create some functional problems, and because of these functional problems, we create some other problems. So it's almost like a chain reaction. So it's very well recognized that in patients with gluten intolerance, there's abnormal production of hydrochloric acid. Actually, typically it's a low production. And when production is low, hydrochloric acid doesn't stimulate pepsin, which is the main enzyme in the gastric area. And as a consequence, we cannot digest proteins well. So how do we fix it? So there's a product, it's called betaine HCl, or betaine hydrochloric acid. It's a carrier of hydrochloric acid, and by consuming betaine HCl before eating foods, you can fix the problem easily without upsetting your stomach much. Pancreatic insufficiency and deficient production of so-called digestive enzymes is extremely common. In my practice, probably 70% of people with gluten intolerance have this problem, and although you're completely gluten-free, the problem still exists for years and years and years. So how to fix it? Obviously digestive enzymes, which we recommend to take with meals. So there are different groups of digestive enzymes. For those who have mild deficiency, we recommend enzymes from porcine pancreas, so-called pancreatine. It's a standardized product which has been on the market for years and years and years. For people with more advanced deficiency, we recommend plant enzymes, which typically derive from pineapple and papaya. They have much, much stronger mode of activity, and they work at different pH, so they're pH independent. So, and finally, for those who have extreme deficiency, we recommend enzymes which typically derive from medicinal mushrooms. These are the strongest enzymes. You need to be careful with them because they can upset your stomach a little bit. But again, you need to talk to a physician and define which group of enzymes is the best for you. So not only pancreatic deficiency do happen, also deficient production of bile acids happen. And bile is almost like a soap, so your food needs to be kind of meshed and mushed a little bit, and so it happens with the addition of bile. So bile can spray your food every time when you enter the duodenal area. And in order to stimulate bile production, we're using milk thistle, which is a well-recognized product. And also, we started using recently ox bile, which works quite well. And you take it with your meals, especially if you're eating fatty food. And fatty food meaning even fish oil is a fat. So pernicious anemia, which is B12 deficient, is easily fixable with B12. One thing which I want to remind you that B12 is very sensitive to acidic pH. So when you swallow pills containing B12, most likely all the B12 will be destroyed. Because of that, you need to use either sublingual B12, which gets dissolved and penetrates in your body through your oral area, or injectable B12. So next topic, which is a bit esoteric topic, but it becomes more and more kind of fashionable, and it does make a difference in people's life. It's methylation defect, so-called MTHFR enzyme mutation. So methylation is a process which regulates gene expression, so the genes turn on and off through methylation process. And this is one of the key enzymes, MTHFR, which regulates this process. It's been described around 10 years ago that a lot of people with celiac disease, especially, and with gluten intolerance as well, had mutations in MTHFR. And because of that, they don't methylate proteins well. As a consequence, you may end up with so-called deficient methylation status. How do we measure it? Well, homocysteine, which I mentioned on the previous slide, is a marker of hypomethylation. When you don't methylate well, homocysteine goes up. And so this process is easily fixable. So there's methylfolate, which is methylated folic acid, and it's a carrier of methyl groups. There's a product which we'll like more and more right now. It's easily absorbable, no matter what, no matter whether you're gluten intolerant or not. It's very easily absorbable, and it also gives you a sensation of kind of almost happiness. So it's almost like a serotonin releaser. So it's a TMG, or trimethylglycine. So, and trimethylglycine is one of the strongest methylators available, and also methyl B12 can be used. So changes in gut microflora, so-called dysbiosis, is another problem which we see all the time in patients with gluten intolerance, and it's because, again, our gut is regulated by the food, and because we have problems with the immune system when we're gluten intolerant. So there are a number of different reasons why we develop dysbiosis. So again, as a consequence, we may be dealing with some vitamin deficiency. I mentioned one of them, such as biotin, as well as yeast overgrowth. And so that list can continue and continue. And so the simple solution is to use probiotics and prebiotics. So the next topic, which we're going to discuss briefly, are foods which cross-react with gluten. So it's been described and discovered many, many years ago that completely unrelated foods such as cow's milk, chicken eggs, and soy contains fragments in their molecule which are very, very similar to gliadin, which is a part of gluten. And therefore, if you're gluten intolerant, you have a higher chance of having intolerance to these products. So for example, if you look at the thorough scientific studies, it's been shown that approximately half of the people who are gluten intolerant have problems with cow's milk because of the casein. So 20 to 25% have issues with albumin from chicken eggs, which is kind of egg white, and the same amount of people have issues with protein. So how do we deal with that? Well, first of all, we recommend to eliminate dairy products based on cow's milk. So products from goat and sheep milk in general are fine. So, and this is true for all dairy products based on cows and sheep milk. So the cross-reactivity is very minimal with these two particular products, less than 5%, and most of the patients in our practice can handle them well. One thing which I want to remind you that pure whey protein, which doesn't have casein, is fine. So you just need to read the label and be sure that it's casein-free whey. So there's no any cross-reactivity between the whey from cow's milk and soy, and gluten. So this is completely safe to use. So again, the similar situation is with chicken eggs. So you need to eliminate foods containing egg whites. Egg yolk is absolutely fine. You don't need to worry about that. Duck and quail eggs are safe to consume, and there are more and more duck farms around San Diego, especially North County, which produce a sufficient amount of duck eggs, and you can buy them on farmer markets around Encinitas, for example. And so the issue about chicken egg yolk sometimes is controversial because it depends how clear the egg yolk from the egg white. And so typically there's some contamination. That's why, there's some paranoia about that. But if you're talking about pure egg yolk, it's absolutely fine. So there's no any cross-reactivity. Soy protein, it's the same situation. You need to eliminate soy-containing foods from the diet. One thing which I want to mention that soy-based lecithin in general is safe because when we're talking about cross-reactivity, we're talking about soy proteins. So soy lecithin, if it's a high-end soy lecithin, can be used without any problems. And a lot of patients in our practice ask us what is the reasonable substitution for soy sauce, and it's a tamarind-based sauce. It's a very reasonable substitution. So it just, one of those things. So yesterday we briefly talked about prolamine intolerance. So what are the prolamines and why are they important? Well, the question comes, if you're gluten intolerant and you're completely gluten-free, but somehow you react to soy, or you react to corn, you react to rye, you react to oats. So what's going on? Why you react to all these things? Most likely you're dealing with so-called prolamine intolerance. So prolamines are proteins with a higher proline content, so our body cannot digest prolamines. So gluten is a part of the prolamine family. So because of that, every time when you consume one of those products, large fragments persist in our body, and if somehow you react to them, you develop a problem. So, and I want to show you this particular slide. So if you look at the different grains, so gliadin, which is a part of the gluten in wheat, so the prolamine concentration is 69%, so it's the highest in the plant world. Corn has concentration of 55, that's why a lot of people with gluten intolerance react to corn, not because the corn cross-react with gluten, it's because corn is a prolamine, and you have prolamine intolerance, so you need to eliminate corn. And if this happens, most likely you'll be reacting to rice, oats, and millet. So if you look at concentration, the lowest concentration is in the rice, but still. So there are some patients who react to rice as well. So unfortunately, there are no any tests which we can utilize in our practice to pinpoint whether you have prolamine intolerance or not. It's a matter of eliminating a particular product and then reintroducing and see the reaction. But again, if you ask me what's the percentage of people with gluten intolerance who are dealing with prolamine intolerance, I would say maybe 15 to 20.